Hey, folks, and welcome to today's SecurityInfoWatch.com's exclusive live web event highlighting technology and management trends in healthcare safety and security. I want to thank Genetech for helping us bring this event to you today. As the healthcare landscape becomes increasingly complex, safety and security leaders face rising challenges in protecting patients, staff, facilities, and sensitive data. Today's live event will explore how cutting-edge technology, integrated solutions, and strategic management practices can enhance healthcare safety and mitigate evolving risks. Hey, I'm Steve Lasky. I'm the editorial director of the Endeavor Business Media Group Security Sector. I will be your moderator, and today's webinar again is being sponsored by Genetech. But start out here with Bernard Scaglione. He's a CPP, CHPA, and a CHSP, and the associate principal at Cerami and Associates, where he leads the security team in the design and consultation of security systems for various industries, including healthcare, government, residential, office, and religious facilities. Joining Ben will be Anjanette Hebert. Anjanette is a CHPA and a CHEP, and she's vice president of healthcare at PAL American Security. And our sponsor speaker today is going to be Hannah Bickett. Hannah is account executive for enterprise sales in the healthcare sector, and she handles the Genetech business based out of the Cincinnati area. So we're looking forward to that. Without further ado, though, but I'm going to hand it over to Anjanette and Ben. So it's your show. Take it away.
Hello, everyone, and thank you for joining Anjanette and me today. For this presentation, we're going to focus on four main objectives: merging security technologies and their integration, overcoming budgetary and compliance challenges, the incorporation of man-guarding within technology implementation, and cybersecurity and physical security technologies. But most importantly, we will offer some best practices and insights into the management of safety and security within the above framework. In order to stay on top of changing technology and institutional needs, planning is an important part of the process, specifically strategic planning, which can help to focus technology purchases and overcome budgetary constraints, and should be part of every security director's portfolio. To effectively select the right technology and ensure budgetary funds, the strategic plan should lay out the purchase and installation phases of technology being selected. An effective strategic plan should look at 3 to 5 or even 10 years into the future, determining what is being purchased and what the cost will be at each phase of the project. For example, if a video system upgrade will cost a few $1,000s, then planning out the purchase and installation over a 2 to 3 year period may be easier to get funding for than asking for the full amount up front and being turned down because of institutional budget constraints. A strategic plan will also ensure that your complete costs are incorporated into the overall budget. When creating a plan, it's vital to review and incorporate specific aspects into the strategic plan's costs. For example, software and hardware costs, annual licensing or annual software upgrades. Installation challenges, right? A lot of hospitals that we work in are older, and pulling cable and or installing card readers or cameras into ceilings can be challenging and increase your labor costs. IT, electrical, and HVAC capacities for your technology, space that may be required to store your technology, manpower that may be required for the use of the technology, other related equipment like PCs, printers, stands, chairs, and all those other equipment-related functions. Also, the required training costs. Keep in mind, strategic planning should be a collaborative, not siloed. Making sure key stakeholders are part of the process and they understand what the plan is, including the terminology that may be used and how it will be used. For example, working with the maternity nursing staff as part of choosing an infant protection system. If the nursing staff doesn't like or doesn't understand the technology that's being installed, then the technology is actually useless or may not be used effectively. Also remember that strategic plans should be reviewed and adjusted on an annual basis. This will ensure the project stays on course and is completed even if there are installation or budgetary setbacks. And this does mean the annual review with stakeholders as well to ensure they will be on board with the chosen technology and its applications. So Anjanette, I'm going to hand it over to you.
Okay, thanks, Ben. A really important piece of planning is ensuring that you've completed a comprehensive risk assessment. We should all be conducting a risk assessment or engaging a qualified security professional at least annually to conduct these risk assessments of our properties. A properly conducted risk assessment will not only help you identify your vulnerabilities, but it can also show you where you lack effective mitigation and where your training might not be up to standards that you need. Among other factors, it will help you to prioritize projects and inform the selections of the technologies that you need through those processes. And so this is what helps you to mitigate the issues that you identify. So you do your risk assessment and you determine where your issues lie, and that will help you to identify effective technology to address that specific issue. The next step, after you've completed that comprehensive risk assessment, should always be a collaborative one. And that is the planning for the solutions. As Ben already alluded to, not including stakeholders in your planning stages is often problematic, can derail a project, can lead to delays and cost overruns. So understanding how the space is currently being used before you implement new solutions or new technologies, you have to understand how the current users are using the space. When you understand how the current users are using the space, and then they understand how new technology or new solutions will impact their use of the space, you'll get a better collaborative approach and therefore better outcomes. And this is going to really ensure you have a smooth implementation process. This applies to design as well as technology. So once you've completed these planning activities and you have a clear understanding of where your risks are and where your vulnerabilities are and how users are interacting with the space, what they expect from the end product, you are now equipped to create your security plan. And that plan will combine the technology and the security personnel that you have available to you into processes aimed at prevention and mitigation of the incidents and effective response that's necessary. So you do that risk assessment to help you identify where your risks are. You have that collaborative planning effort that helps you to understand how your space is currently being used, what processes are currently in place, what users are currently accustomed to. You introduce possibilities of new solutions and get feedback from those users, and then you develop your final plan and your selection of those technologies. And that goes a long way to ensuring you have a smoother transition into full implementation of your product.
When evaluating technology at each phase with the concentric circles, it is important to determine that the chosen technology meets both security and the institution's needs. For example, some hospitals today still see the need to provide unrestricted access onto hospital property and into the buildings, but restrict access inside the hospital. Using the concentric circle model means using security technology in each of the circles: property borders, building entrances, and internal areas. This provides a layered approach, which is a basic security principle for securing any building. We sometimes forget this when assessing security for healthcare facilities, but as a security director, it's essential that we understand and implement a layered approach when designing security technologies. Technologies which will defend, deter, and detect. Another core principle that actively protects against threats, discourage potential attacks, and identifies malicious activities as it happens. Using these two principles in the choosing of security technology together creates a comprehensive approach to securing any healthcare facility. And Jeanette, I'll turn it over to you.
Thanks, Ben. So when you look at the diagram, you note that each layer is unique with variations in the security solutions that are applied. The risk assessment process helps to inform your choices here. For example, a site located in a very high crime area may require a more robust solution on the outer perimeter and aggressive weapons detection at the checkpoint. Consider the need for increasingly more restricted access as the space transitions from the public entryway into the inner workings of your organization. So hospitals, for example, may allow the public unimpeded access into a lobby, but then require special access credentials to enter the emergency department or the pharmacy, for example. But we don't have access, like in a bank, you wouldn't have access to the vault. You could walk up to the teller, but they would have more restricted access as you go into the vault. So that's the idea here. As each layer gets more high risk, you want different solutions to meet the risk that you have on each of the layers of the concentric circle. It's important to limit access in the most restrictive areas with processes that will work for your individual environment. So, for example, card access may work in some areas, biometric access may be necessary in other areas. Those solutions are going to depend on that collaborative approach. What's going to work with the organization? What's going to work in terms of how that space is used? So it's a good idea to flesh out the details of your response plans before you begin the final selection of your technology. When you have a complete understanding of what is expected, like this is how we're going to respond, this is what we want security to do, this is what we want each role to do, then you know how to apply the appropriate technology to get the outcome that you want. Like Ben mentioned before, if the end users are not aligned, the effectiveness of your technology will be impacted by things like they'll prop doors open or they'll share credentials or do other things that will do a roundabout to the security technology and processes that you put in place. Dan, back to you.
So a security playbook provides a standardized set of procedures for detecting, analyzing, and responding to threats. The playbook should be created for all security technology that is being purchased. Starting with a needs assessment, an assessment helps to determine the playbook content, the type of technology that will fit best for the healthcare institution and the security department, as well as standards that will be used in the installation of the technology. So your needs assessment should include the type of security system being used, stakeholders and security expectations for this technology's function, what the security technology will actually do, installation requirements, an installation timetable, and of course a staff training outline. Once completed, the playbook can be created. The playbook for security technology should include installation guidelines like card reader heights, camera positioning, product make and model numbers, plus alternatives, security training requirements, cybersecurity requirements, and supporting requirements, like I said earlier, IT power, and other types of equipment that may be necessary in order to provide that technology. So for me, this is choosing the right technology for the right institution and security staff. I'm not going to delve into the specific technologies that are out there, but instead discuss the implementation of these technologies so that they can be an effective tool in reducing security incidents. In choosing security technology, best practice dictates that you know what types of technology are out there. And I can't stress enough the idea that learning the technology that's currently out there is so important in evaluating technology. Evaluating all the systems within a given technology category, like card access control software or AI camera outcomes. Again, not relying on a specific vendor to tell you what's best. You need to go out there and see what technology is within that specific category and evaluate which one works best for you. Understanding how that security technology works, knowing what its limitations are, again, understanding totally what's involved with that technology, and know how it's being installed. You know, again, what those requirements are, you know, what changes you're going to need to make if you decide to pick that technology. And understand the installation requirements, like I said, making sure there's sufficient staffing necessary space, correct infrastructure, like I said before. For example, I'll give you a couple examples. I've worked with 2 healthcare facilities in the past year or so, consulting with them on whether they want to use metal detectors or weapons detection systems. In the first institution, they had made the decision to do metal detectors, but then when they looked at the cost for staffing them at all their entrances, they realized that the cost was way too much. So they started looking at weapons detection systems. And again, as they were evaluating with metal detectors, there were some entrances where the corridors were a little narrow, there was structures in the way, so it really became impossible for them to install this equipment. But their idea was that with weapons detection, it could be monitored remotely, and that security would be dispatched to the particular area if the system went off. The problem was when they evaluated, they realized they still didn't have enough security staff, and they decided that, again, that cost would be too overwhelming. A real in assessing that technology, they needed to understand that they should have been locking doors. They had 31 entrances within their facility, and that's why the cost was so high. So the discussion was, well, if you start locking some entrances and locking some exits, that maybe you could narrow that down and funnel people into several entrances, and that it would be cheaper and easier and better to be able to screen them for weapons. Invariably, they decided to do nothing because of the overall cost and the decision not to close any of their entrances. The second facility, they made the decision to go with weapons detection systems and started working out the plans to do that. The big challenge they had was in their new, beautiful lobby, massive lobby for their main entrance. There was really no way to funnel people into the weapons detection system. So in order to do that, they literally had to pick up and move planters and change physical structures within the lobby in order to make it happen. Now, they've made the commitment to do that, and they're trying to figure out what they can and can't do in order, to cut down the cost of changing that lobby without ruining the decor. So they're working that out, and they've been given some options in order to do that, and hopefully we'll do that in the future. I also wanted to spend a minute to discuss the future of healthcare security technology and where the trends are going. I recently had an opportunity to speak with several healthcare professionals on this very topic as part of a security design project. They see security systems being integrated more within other systems in the healthcare setting. So from a strategic plan perspective, it's important to know what other systems the hospital is considering in the future and making sure you have a seat at the table so that security systems can be integrated properly. Some of the examples that we reviewed during our design process was elevator and wayfinding integration into visitor management and access control integration for delivery robots, more medical system integration as we've been seeing with Epic, but providing more data on patient visitors and staff. Video surveillance integration into location tracking systems. Obviously, video used more for patient monitoring. Duress buttons and emergency response becoming wireless and integrated into systems like nurse call or wireless phone systems. And remember that the trend for access control right now is the personal phone. It is and will be used for visitor management, wayfinding, financial transactions, duress and visitor location tracking, virtually eliminating visitor passes and access control cards. So planning and collaboration are more important than ever before. And Jeanette, I'll turn it over to you.
Thanks, Ben. So I wanted to just kind of emphasize part of what you talked about in terms of technology integration, which is incredibly important. And then harken back a little bit to the use of that stakeholder process to develop a plan before you roll out. This example that you gave, Ben, about the hospital who chose not to close entrances and not to put weapons detection leads me to believe that they didn't start with a risk assessment because they decided to do nothing. And if the risk assessment said there was a risk, then you would move forward with a plan. So that's why processes are really important here in understanding I've identified a risk. I need to find a solution to that risk. I need to include the stakeholders that are impacted. Like I've consulted with an organization that did just that, had to close several entrances in order to implement their weapons screening and had a concern about how that would impact the public, their visitors, their patients coming in. And so they had a visitor advisory council, and they had members who gave them feedback and how they thought it would be intrusive and not intrusive, and they worked that into the plans, and ultimately, ended up funneling people into fewer entrances with very, very little pushback from the public once the system was implemented. And it's been going very well since. And in fact, when they implemented weapon screening, the response that was received from the public coming in was, wow, it's about time. We were wondering how long, it would be before they did this, and it actually made them feel safer. So sometimes we're not talking to the right stakeholder if we think taking action is going to have a negative impact. Sometimes taking action will have a more positive impact than we think. So leaving out those stakeholder conversations in the beginning of your planning process can just impede things moving forward. The other thing about integration, and Ben alluded to this as well, is the security officer is an extremely limited resource. And we want to give that security officer as much advantage as we can. So when we integrate systems and we can send, for example, these duress alarms directly to a radio on a security officer's belt and give them the opportunity to respond immediately instead of waiting for that to go through dispatch or whatever, it enhances that response. And those are positive things. And all of that takes integration and planning with all of the stakeholders involved, like IT, et cetera, to make sure that we can do all that. The one other piece about integration that I wanted to bring up was around the consolidation of organizations. So we see it happen every day. Hospitals merge, systems buy out other hospitals. And when you buy that hospital, you buy all the technology that's in there as well. And it might not. It generally never matches. So you have two organizations who are trying to merge everything, and that includes your security technology, while you have a security team that's attempting to function and monitor 4 different systems in, 3 different hospitals, et cetera. So in that strategic planning piece that Ben talked about, understanding that when we go out and buy new hospitals, that security technology may not easily integrate into ours. And we need to plan for that. And we need to understand which system are we going to select and how are we going to integrate all of those disparate systems together. So now moving from the technology piece and talking about external factors. We know times are changing. We're watching it happen, in front of our eyes all day, every day. And hospitals and healthcare organizations, still remain some of the most regulated entities out there. So it's an important and necessary step to any planning for technology is to ensure that we're in compliance with like everyone, and not Joint Commission or DNV, whatever you've chosen. Sometimes OSHA has a play, and then you have all the building codes, et cetera. So there are a lot of factors to consider, not to mention privacy rules, HIPAA, et cetera, when implementing new technology. So it's important that we're up on all of that as well, so that we're not spending a whole lot of money only to find out in the end that we're not going to be able to implement this solution because we violated some, rule or regulation that we were not aware of at that time. So I'm going to turn it back over to you, Ben.
Thanks, Anjanette. So for me, external forces are really important to evaluate in the application of security technology, right? Making sure that security technology is working properly and is not compromised in any way. And generally ensuring that, the technology through IT systems is up to code, up to regulation, and that you're not using expired security software. So making sure malware updates are taken care of as part of the physical security landscape for the protection of systems. And when we talk about those systems, it's really important to focus on what's the current trend, which is cloud-based systems. And taking a look at how those cloud systems can be protected. So when we talk about protecting ourselves from external threats, it's important that the IT department, especially if you're in their closets and running off of their network, is happy with the physical security installations that are residing on the networks, and ensuring that all security systems meet HIPAA, ISO regulations and internal standards for firewalls and malwares, and also the other regulations that Engineer had mentioned. And again, knowing and understanding how security technology works, especially when we're talking about cloud-based systems. And a thorough evaluation by both the security department and the IT department should be done before purchasing any cloud-based systems, so that your installation is successful and operates the way you want it to operate. For some of my most recent security designs, we're actually installing, for some of the most recent cloud-based designs, we're actually installing limited on-site storage as well as cloud-based storage to provide insurance in the event that the cloud-based systems fail or are compromised. In this way, they have some data, or like all of their access control data and a good percentage of their video data on site that they can recover. Another consideration in purchasing security technology is any changes in, obviously, the new HIPAA standards. We know that there's new standards coming out shortly. And it's important to make sure that the electronic security systems and the institutional's IT systems are properly protected and that their audit tracking is being conducted. Ensuring that the systems are evaluated periodically, installed correctly, right, to meet those regulatory requirements. Making sure that all your software is up to date, all your malware and other types of protections are all up to date. And again, making sure that you're interacting with the IT department to ensure that they're happy with, all those software updates and everything that's going on. And lastly, obviously, to make sure that IT equipment's physically locked down. And again, physically protected against any type of person trying to destroy or vandalize the system. And it's important to know, obviously, what the future will hold. And it'd be great if we all had a crystal ball and were able to predict the future, but we're not. So it's great to be able to predict the next major security risk that will be in healthcare, but unfortunately, we're not going to know that. But we can protect ourselves by ensuring that we're continually evaluating the security technology, right? Knowing the products that are out there and how they work, making sure we're compliant with all IT standards, making sure all our equipment's up to date, so that whenever a new threat does evolve, the security technology will help to mitigate that risk. Again, it may not be the perfect solution, but it might put us in a position to temporarily mitigate that risk, and or adding additional equipment to that existing technology to be able to minimize or eliminate that risk going forward. So I think that concludes our presentation.
Thank you, guys. I appreciate that. So most healthcare organizations face not only incident response challenges, but also staff shortages. Security and IT teams manage a range of systems like VMS, access control, fire alarms, and more, often across disparate platforms. The solution to alleviate alarm fatigue is a unified platform that can correlate data from multiple sources in real time, enabling a rapid and coordinated response to any event. I came across some interesting statistics in relation to healthcare employees. Healthcare organizations obviously have the goal of increasing patient satisfaction, but this becomes challenging when they are short-staffed. The cost of recruiting a nurse can be upwards of $55,000. That's important data when we're discussing workplace violence. If your staffing retention rate is decreasing to workplace violence, then we need to look at ways to mitigate these risks. So this isn't just about the safety of the floor staff, but for the entirety of the organization, patients and visitors. When your system is unified, the system can automate responses like locking doors to prevent unauthorized access or redirecting people through predefined evacuation routes. This is especially critical in high security areas such as where pharmaceuticals are stored or in response to a security threat such as an active shooter situation. Advanced analytics enable real-time detection of suspicious activities, which reduce response times and thus improve overall security awareness. For instance, if someone is lingering in a restricted area, the system can flag it and alert security personnel, even providing them with contextual information such as footage, access logs, and nearby alarms. Weapon detection security devices are becoming more common due to legislation beginning to mandate this technology. Specific cameras now have weapon detection analytics and can identify if a person is carrying a weapon on their body. Some of the recently passed legislation is requiring certain states to have weapon detection at the entrances of all emergency departments and behavioral units within a healthcare organization. So this is something certainly to be aware of. You can also use analytics to alert based on directional flow of traffic by detecting stopped vehicles in target areas. Think the emergency department drop-off location. Or when vehicles are moving in the wrong direction, such as a parking garage. You can even utilize LPR analytics as a credential, but also to create hot lists and manage employee parking or physician-only parking lots. It's also important to consider your SIP intercoms and speakers and have those on the same unified platform. For example, let's say I work on the labor and delivery unit, and I notice that a suspicious adult is attempting to quickly leave the unit with an input. I can push the panic button that alerts a code pink. The announcement of the code pink is now being played over the IP speakers. The unit automatically goes in lockdown. Security has been alerted, and we're also tracking the RTLS Hugs wristband on the infant. So using real-time data and analytics, these solutions empower healthcare providers to proactively manage risk and streamline incident response. For example, Security Center enables security teams to monitor and manage incidents from a single interface, using video surveillance, access control logs, and even environmental data such as temperature or humidity. This data-driven approach not only helps mitigate risk, but also ensures a quicker, more coordinated response. Data breaches in healthcare can be just as detrimental as physical threats to personnel or patients, and that's why we believe that a unified approach is key. By combining access control systems, intrusion detection, and surveillance with IT security protocols such as data encryption and multi-factor authentication, healthcare providers can reduce vulnerabilities in both physical and digital realms. We understand that budget constraints and compliant requirements are just two factors that healthcare organizations face when considering a new platform. That's why we stress the importance of an open platform that has a migration path, as well as working with a manufacturer who meets rigorous compliance standards, such as HIPAA, SOC 2, ISO, and even Joint Commission. This will ensure that your organization has a reduced risk of fines and legal ramifications while migrating over to a truly unified platform. These integrations ensure that not only are physical threats mitigated, but cyber risks are managed effectively, creating a truly holistic security system. And Steve, I'll hand it back to you.
All right. Well, we have a lot of time for questions. Thank you, Jeff. Jeff from Vancouver Coastal Health. Jeff says that you had mentioned challenges bringing disparate systems together, e.g., acquisitions that come in with their own technologies, strategies. So what are, and I guess he's asking, what are some of the strategies to integrate using PSMs, or are there other platforms?
So I think the issue again is, and Anjana kind of mentioned it, is the importance of a risk assessment. And when it comes to security technology, it's really assessing what you have, how old they are, and where they are from a technology perspective, and then making a decision about what you think is the best technology moving forward. And also part of that process is not only just choosing that technology, but again, it's implementation. How long is it going to take? What is it going to do? What's your downtime? Can you move, for example, with access control, can you move the databases into the new system, or does it have to be done manually? All those questions need to be answered as part of that process. And as Jeff asked, there's also the possibility of purchasing technology that can rest upon all the other existing technologies and operate them so that you don't have to change them out. The risk, however, with that is ensuring, or learning what options will be functional when it sits over each of those other disparate technologies, because they may not be the same for each technology. So, your time zones, for just a basic example, may not function the same way on each of the systems, when you're using a system that lays over the top. So again, it's important to know those things beforehand, and that's why you want to do a needs assessment or assess that technology and understand, what's going to work, what's not going to work before you make that system. For most of the consults I've done, it's really been an analysis of what's the technology that seems to be moving into the future, advancing, and will be around for 10 or 15 more years, and then just seeing if that's the technology that's chosen, seeing if, how that technology can interact with the current systems, what panels can be saved, what panels need to be replaced. Again, when it comes to CCTV, it's really, nowadays it's all on the network, so it's really just changing out software. But again, when you do that, you have to make sure that that software properly integrates with those particular cameras, especially if the cameras are older. The software may not integrate with them, and those cameras may need to be replaced, or you may limit the functions that those cameras have, especially when we're talking about AI or other types of camera technology like motion and some of the other things that Hannah mentioned as part of her presentation.
Right. Yeah, I mean, I imagine that the unified communication and interoperability of legacy systems with new things being put in is crucial. So, from your perspective, how do you look at it?
Well, much like being said, you have to start with that risk assessment, and sometimes we have to acknowledge the fact that the technology that's in place is obsolete, and it's no longer supported. So you kind of have to prioritize. If it's such a big job and you can't get everything done all at the same time, in your needs assessment, your risk assessment, or whatever, you kind of marry the two together. How much risk do I have with having this system? For example, if I have an infant security system that's no longer supported, that may be a higher risk than an outdated CCTV camera that I have to watch on a different monitor. So I might prioritize that infant security system over the video system in doing my, my upgrade or my integration or whatever first before I do something else. So it's not an all or nothing approach. We all know hospitals do not have unlimited amounts of money, and we don't have unlimited resources to be able to do the work that needs to be done. So when you look at trying to merge all these different technologies and upgrade at the same time, that risk assessment really comes in handy, and that ability to collaborate effectively. Because sometimes, as shocking as it may seem to us as security professionals, the clinical staff are quite attached to whatever system you're trying to replace, and they don't want to learn something new. Don't have a good relationship with them to move past that and show them the benefit, then that's another obstacle that you have to meet.
And and it kind of segues great, in great fashion with you, Hannah. Being a solutions provider, how do you approach that issue with them? After you've run your risk assessment and you've gone through the disparate systems and you're trying to integrate technologies that you're working with, that you guys are spotlighting from a solutions provider's perspective. What's your approach?
Yeah, absolutely. So I'm actually working with a large healthcare organization right now, and they're currently using a very old access control platform and CCTV solution. So they're not in compliance with what they currently have, but access control is taking priority. And, we're also working with their budget constraints. So again, we do understand that. So the way we're approaching it is we are bringing their access control on with Genetec. And then the plan is to have like a 3-year migration pathway to bring on cameras. Some of their cameras are not compliant with the U.S. government. So cameras like Hikvision, DAWA, most of those do not meet compliance for hospital organizations, especially if you're getting any type of federal grant money. So some of their cameras will most likely need to be replaced. Some are just old, like you guys have already mentioned. They have requests for newer analytics technology that their older cameras cannot provide. So we're going to start with the access control to secure their premise, and then we're going to move their cameras on to Security Center as well. And then once that phase 2 is up, which is the cameras, then we can look at securing their parking lots and their parking garages through LPR devices and additional cameras out there. So from our perspective, we always have migration pathways set in place, and because we're a truly open platform, we can flash different merger boards. We can do things like that. We work with all the big camera companies, so we're not pushing one hardware manufacturer. We work with almost all of them, and it makes it a little bit easier on our end.
Okay, great answer. We've got a good question here from kind of an open-ended question, I guess, from Max at Castle. So as a systems integrator, I guess the question is what are some of the most popular video surveillance CCTV and PACS systems or brands out there that are, targeted at the healthcare industry? And, should he be looking at technology features and capabilities that are going to be unique to the vertical that would be healthcare? Ben, you want to start us off on that?
Sure. So I'm not going to go into specific brands, but when I was a security director, we did an analysis of what was out there, and pretty much the healthcare market was pretty much dominated by one or two access control companies. There are others, and Genetec's one of them that's been making a lot of headway in recent years. But the thing is in healthcare is that the access control system, again, it's not a standard workday. It's 24 hours, 7 days a week. So there are staff that, time zones, for card access don't always work because staff work overtime or move from place to place. So those types of features sometimes are difficult. Healthcare also likes to do a lot of verification. So areas like pharmacy and other types of high security areas, you may want to have a system where it requires 2 cards in order to open a door on certain hours, like getting into the pharmacy off hours to obtain some drugs and those types of things. So some of those are the unique feature. But I think probably one of the biggest challenges healthcare has with access control is the fact that staff really can't be confined to a particular time zone or a particular set of access cards because, again, depending on the size of the institution, there may be 100 or 200 nurses that are floating from floor to floor and require access into supply rooms, medication rooms, and those types of things on any given day in any different location. So that's some of the challenges.
Hey, Jeanette, can you follow up on that?
Yeah, I know exactly what Ben's alluding to. Hospitals where you'll have 4 people in the same department who need 4 different sets of credentials depending on their role and where they need to be in the organization and the time they need to be there. Access control solutions have to be pretty sophisticated, and with that sophistication comes an expense. And I think that's where a lot of organizations balk at, it's in order to meet your need of having all of these different levels of credentialing and access control, the ability, to set time zones and all that it costs. So it raises the cost for the organization to be able to do that. But it's possible to do it, but it also requires administrative oversight. So you have to have someone, not your hourly security officer, who's managing, the issuance of credentials, because it becomes very sophisticated and very high level. So it's a whole process. It's not just making access cards and handing them out, to people. It almost becomes a individualized access, for that person. And it's possible, but it costs more. To Ben's point, it's not your basic access control off the shelf where everybody comes in 8 to 5 and you give them all the same card. It works a little bit differently than that.
The other speakers alluded to, we're seeing mobile credentials becoming more and more popular, not just in healthcare, but across all boards, because people are going to leave their cards in their car, or maybe they stick it in their scrub pocket and they wash it, and they get to the healthcare facility, and now they don't have their credential. But everyone always has their cell phone. So From a compliance issue with Genetec, we've worked out everything on our end, like with HID mobile credentials, we're seeing that push. But they can be a little bit more costly depending on what road you go down, and that's something that's dependent with each organization.
I was part of a security design for a children's hospital 5 years ago, and when they asked the same question: what's the current technology, and what do we, when we build the building 5 years from the design phase, what's current? So we provided them with whatever technology they needed on the assumption that they were going to be using maybe access cards, most likely access cards, but probably personal cell phones. Unfortunately, they didn't go in that direction, but again, HID has a great variety of card readers that can accept that technology today. So most of my projects that I do, we use those card readers with the assumption and also, the client's preference to be able to move in that direction. But I have to tell you, we're working on a huge healthcare facility right now, and that same topic came up, and we were very clear that that's probably where things are going to be going. I think healthcare tends to be a little behind the curve, where they don't always ask that question, especially today. So, for industries outside of healthcare that I do design work and consultation work for, they want to have that technology today, and they want it up and running. For the healthcare facilities, it's more like, yeah, it's interesting. We'll see what happens. We'll see what happens in a few years and what direction we can go in. So we try to advise them to work accordingly. But the one big problem in healthcare that's not going to be overcome by using a phone for access is the fact that the staff on the floor want to know you belong or don't belong. So a physical pass, whether it's in your hand or stuck to your body, is going to never go away in healthcare for that reason.
Yeah, and if I could, that was the point I wanted to make. I think hospital administrators are going to be reluctant to give something other than the badge as access, because that's how we got everybody to wear the badge, is, you tied it to the access control. I do see, however, a future with mobile credentials with the medical staff, the physician group. They don't wear badges already in most cases, and they would be more adaptable to using mobile credentials, and that would be a satisfier for the medical staff. So I see that as an area where healthcare organizations might delve into that technology, even while they're resistant to do it for staff who they want to make sure is wearing a badge.
We did work on a design where, the patients handle their visitor management. So they're actually sending a text message and or a email to anybody they want to visit in the hospital, and that provides them with a code or an NCR code. So when they come into the hospital, they go up to a kiosk, present the NCR code, and it prints out their pass automatically. But it also can alert the hospital that the person's in the building.
Good way to finish off here. Well, I want to thank everybody who attended today. We had a good crowd. My thanks again to Ben, to Jeanette, and to Hannah, our production and our manager, John, in the back there. And stay safe and keep your heads down, and we'll see you then.